well, I guess we're supposed to start. It's 12:10. Um, sorry about the microphone. We're a small group, but it's being recorded, so we have to use the microphone so the people elsewhere can hear what's going on. If you have a question, we'll have to remember to repeat it so it makes sense to the people listening to the recording. I'm very sorry about the PowerPoint. I know you've got serious PowerPoint fatigue, a lot of it administered right in this very room. But it'll at least maybe keep me on track a little bit. And then we'll post this on the One Health website as well. So you'll get that, and hopefully we'll be able to post a link to the recording as well. At least that was the intent. So anyhow, Dr. Melinda Wilkins and I are going to talk about two of the dual degree programs that a lot of students here do, the MPH degree and the MS in Food Safety degree. And I was involved in really both of the programs from the primordial soup stage up to the current. And Melinda, until last year, was the advisor for all the vet students that were working on the MPH degree. And there's 38 of them now, from as far as we can count, seems to be that. And then just, how many months ago? 5 months ago? 4?
Yeah, August.
Oh, August? Was it that long? Okay.
Yeah.
She moved to become the administrator and the director for the MS and Food Safety program. So she knows both programs extremely well at this point. Mm-hmm. So we just want to talk about, not just about the mechanics of the programs, but more about, the discipline and the prospects for employment, the kind of things you do with these degrees, and kind of the specialty in veterinary medicine. Right, so that's kind of what I said. So probably about a fourth of all veterinarians are not in private practice, and we call that public practice or government and corporate veterinary practice. I don't like to hear alternative careers. I hate that. Well, it kind of looks like a second thought, But at any rate, so it's probably about a fourth, and the AVMA statistics show it being a little less than that, but here's some epidemiology. It's a biased sample because, I'm not a member of AVMA anymore. They charge a lot. I don't see that they represent my interests anymore. I don't need the practice insurance, so if you're not in private practice, then why should you pay the really high membership?
Right.
Right, so I've asked Melinda to jump in wherever I leave something out, or say something wrong, which is probably going to happen. So also I think, when you get out into a specialty, like if you become a toxicologist or food animal veterinarian, you're going to join the American Association of Food Hygiene Veterinarians, right? And your membership in the AVMA is going to be less important to you and expensive, so you're going to drop that. So as far as we know, we think it seems to be about a fourth and maybe increasing, but anyhow.
I'd guess quite a bit higher.
Yeah. So on the federal side, most of the vets that work for the federal government are working for USDA. Oops, oh no, what did I do? Dope. Oh, I'm trying to get this. Oh, there it goes. All right. So, they work for meat inspection. That's 1,000 jobs, right? Looks like a lot. About 10 years ago, it was 1,500 jobs. So it was half against. We've lost 500 jobs in that field, just mostly to other professions because I don't know, our profession didn't want to do it, but that's hopefully changing. So then other areas of the USDA as well, and then Army. So those are the big employers. So examples of public health jobs, and Dr. Wilkins, you can help me with this. There's public health departments, basically, at the local, the state, and the federal. There's a student, Dr. Peters. She graduated here not that long ago and just completed her MPH, and she's at a local health department now, and she was just at the state health department. The federal level is mostly CDC, FDA type things.
Yeah, and FDA, I think, there's a lot of money that's being shoved into FDA right now. I think there are going to be a lot of opportunities for veterinarians. And with the U.S. Public Health Service, it's a lot of CDC veterinarians are members of U.S. Public Health Service, and they just posted 20 new openings for veterinarians. So there's actually quite a bit of hiring going on in some of these bigger federal agencies.
I agree. FDA is only going to increase in scope as the public demands.
Well, and Obama recently proposed a consolidated food agency. So instead of having USDA regulate half the food and FDA regulate half the food, one of his proposals is to have one big umbrella agency. And so there's a lot of changes. There's a lot of activity in that area.
Al Gore proposed that too. They've been proposing that forever because the system now is absolutely crazy. But anyhow, yeah, Department of Homeland Security, EPA, CDC, NIH, local animal control offices. I mean, that's seen in local governments. So in a county, for example, if you're involved in the shelter, you're probably going to be affiliated with the local health department. We talked, like in Army, Air Force are the big things in the Department of Defense. International organizations, and then private industries as well, especially on the food side. But the pharmaceutical industry, animal feed, so forth. So I've listed some of the specialties there. If you're interested in that kind of thing, this, an MPH would be a good program for that. And we'll talk about the MS in food safety too. Oh, also private practice. Both of us know a lot of people who work as public health veterinarians that also do private practice on the side. Dr. Hamels in animal care with USDA, he's always practiced on Saturday. He says that's the perfect amount of private practice. Dr. Nancy Frank used to always practice. Some of the Army people and Air Force people, they will practice like a day a week on the side. Some of the USDA people do as well.
Just keep up your clinical skills and keep up the speed on that.
Yeah. So you can still do that. 40 hours a week is, most of the jobs in public practice tend to be about that. And some people, have time in their lives for more. All right, so the prospects. So I've been... Right. So I kind of have a thesis here that it's going to be unlikely that public health veterinarians are going to saturate the market. And historically, there really have been pretty good jobs. And a lot of it just relates to the relative size of the veterinary profession and the public health world. There's so much interdisciplinary area in public health that there's a lot of room to grow. So this is sort of my schematic, and I actually share this with the sophomores. How many of you here are first-year students? Okay, good. Most of you, good. So I'll show this to you in public health in third semester. But here's public health, this big circle. And, all these different disciplines, intersect with it, including our profession. But there's a lot of interdisciplinary area. And there's a semi-porous membrane separation there, such that there's a lot of movement out into the interdisciplinary area. And I don't know why, but it seems like the vets do extremely well in the... Did I just do that? That's really rude. It's interesting. I can't do anything until it goes through its cycle. That's okay. So I'll just continue until I can push the button and start it again. Anyhow, right, so I would like to say it's our tremendous epidemiology class and our public health class and so forth, but, it's probably really not. It's that as a veterinarian you learn medicine, right? And that's something that none of those other disciplines there probably, well, except for human medicine, really have. You learn pharm and toxin, anatomy and physiology and micro and path. So you're fluent in the language of medicine. Something I learned after I was out of vet school is I could go to any human hospital and pick up a chart, and I could read it. And the people that were alongside me at the state health department could not do that.
Yes.
Yeah. And so you learn medicine and diagnosis and treatment and aseptic technique that they're using, like Ebola, or out on a farm when you're trying to avoid avian flu or something. You learn a lot of those aseptic techniques in surgery and so forth. Disease transmission and disease control are taught in vet school, and always at the population level.
And I think that's why veterinarians transfer so well into public health and into some of these other positions, because they're problem-solving generalists, but you can talk to the laboratorians pretty well. You can talk to physicians. You can interpret test results, whether it's on a person or an animal. It's all the same stuff, slightly different reference ranges, right, that you just look up. But I mean, it's not that you're going to be advising on human health issues, but you could be taking phone calls from physicians, from infection control practitioners at a hospital. You can just flow into that without any problem, and it's really a nice feature.
So as a result, our graduates seem to prosper in this interdisciplinary area, and every time we talk to them, they've got promoted and so forth. So, there's also a lot of increased interest in these public practice areas with all the headlines. I'm not going to read all those. Like 75% of the priority pathogens for biological warfare are zoonotic diseases, so that means a lot of research, a lot of surveillance of those things. Lifestyle, so it's hard to generalize all the jobs, but most of them are about 40 hours a week, not on call, usually ever. There's a stable salary. You don't have to worry that maybe you're the best practitioner in the county, but you're worried the best practitioners in the state's going to start a satellite clinic across the street from you. You don't have a lot of the financial worries and business responsibilities, so there's less economic risk. You don't have all your money invested in one practice. Vacation days, how many days does state have?
Oh.
The feds have even more than the state,
yeah,
right? Like
yeah.
13.
And they all have more than MSU, for the record.
Yeah.
But you'll have like 3 weeks of vacation time, pretty much. And you get regular holidays, plus you get vacation time, you get sick leave, and the benefits. Really, if you're looking at salaries, you have to factor in the benefits, which generally are really good, especially if you're federal. Especially if you go with U.S. Public Health Service, which is actually an unarmed branch of the military, and you can have full retirement benefits in 20 years, and you won't find that pretty much anywhere else. So a lot of people do 20 years with the U.S. Public Health Service, full retirement, and then they start their second career doing something else for 20 years. It's a pretty sweet deal.
So the job opportunities, they seem to be okay, and because we're a small profession, I don't think there's any way that we're going to fill up the public health world. Part of it was there has been a lot of interest by veterinarians in the public health fields, and part of that realistically is kind of that private practice maybe is a little less attractive than it used to be, and I'll talk a little bit more about some of those things as the middle class incomes disappear. People have less money to spend on pets and so forth. Right, so how much food animal do you have to take? To be a public health vet or to work with the USDA, just as an example, do you need to be a dyed-in-the-wool farm kid that's been around animals your whole life? And no. I'll let you talk on that because you were one, right?
Yeah. Yeah, just looking back at the public health vets I know, or the food safety vets, they're, a few of them have really distinct large animal type backgrounds, but far from all. I mean, just predominantly small animal anymore because that's what's coming through vet school. So, you pick that up as you go, and you wouldn't be asked to do something outside of your comfort zone either. So, I know when I was with the state of Michigan, and we had a problem on a poultry farm, and I said, well, let's go get some samples, and they all looked at me like, what? And I'm like, I have enough boots and coveralls for everyone. Let's go. So if you're comfortable, then you just go, and if not, then you call somebody else from Department of Agriculture, and they'll come, help you get out onto the farm or something like that. So, you go where your comfort zone is and get help outside of that comfort zone.
So if you would like to do the MPH program, I mean, it'd be nice if you were going to have a job as a regulatory vet. You should know something about food animals, but you don't have to know how to do C-sections or LDAs. You need to know how to draw blood samples and move animals around. I mean,
and basic biosecurity.
Right. So after about 10 years, well, actually 30. Okay, it's pretty easy when you talk to a student to know if they should do the MS in food safety or the MPH. So if a student comes to either of us and they're really interested in food animals, they're thinking about being a practitioner, but they realize that treating sick animals isn't something they're going to want to do maybe into their 40s and 50s, and they know that economically they need to move beyond that, right? And they're thinking, getting more involved in the food production system, not just in the treating sick animals. Clearly, MS in food safety is the way that they should go. And we'll talk a little bit more about the specifics of that. On the other hand, if someone really doesn't want to stay in the food safety area, they're really not into food animals so much, but are interested more in agency work like CDC or FDA even or so forth, then the MPH would be the logical choice to go. The MPH is a more recognized degree, but there's like 50 universities that have that or something like that. There's a lot. In the United States that have the MPH degree. There's only us that has the MS in food safety.
Well, the University of Arkansas just started last year an MS in food safety program. So, but we're not worried about them.
Okay. So anyhow, just some general advice. Make a lot of contacts and get some experience when you're in vet school. Summer jobs are really great chances to get experience. There's two good programs that I'm sure you'll learn about here. There's the NIH one and the Food Animal Fellows program that hire a lot of people. Kind of all the jobs have sort of been centralized in those two programs. So you'll start seeing, you've probably already seen notices, right? Okay. And of course, you want to pick good clerkships, but that's not coming for a while. Right. So my crystal ball as to what the future is going to look like is probably no more clear than anyone else's. But in the food animal world, I think as the food animal industries tend to consolidate and become integrated, the skills of a veterinarian are going to relate more to the food chain, up and down the food chain, and food safety issues and animal welfare issues. More of a food system approach rather than treating a sick individual animal, one animal at a time. So I think that food animal veterinarians may, a larger percent of them are probably going to be employed by a large company or a large regulatory agency rather than like the James Harriet type of of a practice. So the problem is that this expertise is going to be needed for biosecurity, food safety, animal welfare, food security, but it's not the kind of thing that you can really charge to an individual farmer. So I think it's more going to be a large company or a regulatory issue, regulatory agency that could more likely be the employment route for a lot of public health activity. Okay, dual degrees in general. In general, these two degrees that I'm talking about, the MPH and the MS in food safety, the idea is that you should never have to take a course in these at the same time as your DVM courses. Now, some students do to save money because MSU has block tuition. So if you're taking, like in freshman, do they say it's 20 credits or 18 credits? Or what do they say it is? Something, it doesn't matter. They charge you the same amount anyway. They could say it's 30 credits, it doesn't matter. But if you wanted to for free, you could take a swimming class or an archery class or something like that.
In all your spare time.
Yeah, in all your spare time, but of course you don't. But so, but there are a couple of places in the curriculum where students have learned they can take a class for free. So it happens, although I have to look the other way officially.
Well, and I don't know if we ever mentioned, both of these programs are entirely online.
Oh, good point.
So, you know, this is you know, the big plus about that you can do these, you know, you can do these in the summer, you can do them, you know, focus on the weekends or something like that. You can do them before you start vet school, you can do them, you know, finish up after you finish vet school and moved away. So that's a big promo we should probably put in cap.
I'm sorry, I should have said that right up front. And I mean, if I ran the zoo, I mean, I think it's horrible to have to pay for 4 years of undergrad and then 4 years of vet school. And I think the things that you would learn in either of these two-degree programs, they really should be taught in the track program and the DVM program. And so you'd graduate if your DVM having focused on food safety or public health or something like that. So, you know, the debt load that students have now is just ridiculous, and to be a part of recommending that people spend more money keeps me up a little bit at night sometimes. But you have to not look at the history of it. You have to look at where you are right now, and how do you get to where you want to be, not the places that you've been already. Because so anyhow, forward. I'm torn, but one of the reasons that you might want to start a degree now is that you'll have at least started on it when you're applying for that first job. That's when it's going to do you the most good. Realistically, after you've been in a job with, let's say, an agency like USDA and you've been there for 10 years, it's your experience that's going to be kind of the most important. So the time when you need that extra degree and that demonstration of your interest in this as a specialty is like right when you're getting your first job. And the public practice jobs are getting more competitive. There's a lot of vet students are working on their MPH or something like that. So there's 38 here now, and this just blows me away. I remember probably 10 years ago we started sending students to Minnesota, and I was blown away that we had 10, you know, at the same time once, and now we've got so many, and there's 8 working on their MS in food safety now. So why start now? One of the reasons for maybe starting now is you can save some money. You get about a third off if you can start now. And, you know, there's such degree inflation now that I'm thinking if you're going to spend your whole career in public practice, you know, maybe you're going to eventually want to get that master's anyhow. But you can do a lot of double dipping. It's all about double dipping. If you can do your field experience and have it count towards your MS in food safety or your MPH at the same time it's counting as a clerkship in vet school, that's kind of what it's all about. or use a summer job to count too. Right. And there's some reasons for waiting to do it later. I mean, I did mine after vet school, well, actually before vet school, and you did your MPH after vet school. But, you know, maybe you want to concentrate on the DVM and get your money's worth of that, you know, because you don't have enough time to get as much out of that as you know, really probably would like to. And you may need your summers to restore your sanity instead of taking online MPH or MS and food safety courses. And it's expensive, right?
Yeah, I was trying to do some quick calculations. I know the MS and food safety is going to add, you know, $15,000 to $16,000 to come up with that degree. And that's even taking into account that you can transfer in 9 credits.
Right.
And for the MPH, it's a longer program. 42 credits are required, so it's going to be anywhere from, you know, 18 to 22,000, depending again on how much of the overlap and double dipping you can pull off while you're doing a dual degree. So it's not inexpensive. Relative to vet school, it might seem inexpensive. I'm not sure.
But it's pretty hard to find a master's degree that's cheaper, especially the MS in food safety at about $16,000. I mean, I don't know where else you can get. And the real cost of a graduate degree has traditionally been not the tuition. It's not working for a year while you are getting that extra degree. So it's an opportunity cost, the economists would call that. So if you would normally be in a job as a veterinarian making $50,000 a year, you're giving up that $50,000 to get your MPH degree. That's way more expensive than the tuition. So I'm going to talk, and not me, I mean we are going to talk about the specific degrees, and then I'll mention some of the clerkships that you can use that would integrate with these programs. So the DVM MPH program, Linda, you?
Sure. And we have, I think I mentioned you can use 9 credits of your DVM curriculum to transfer in as electives into the MPH program. You can also take, like Dr. Bartlett said, you can use one of your rotations to count as sort of your practicum experience. You still have to pay for both sets of credits for both degree programs, but you can save quite a bit of time. And then if you start your MPH soon enough, like after your first year, then you can take some courses in the MPH program that you then don't have to take during your DVM curriculum, which means you take them early on, preferably over the summer before you start your second year, and then you have some space in your curriculum, your vet school curriculum, to take a couple more electives under block tuition, which is kind of nice.
So save you another 6
credits there that you can save.
But you've got to do that
early on.
Yeah, right. So as long as you start after your first year of vet school, you can do that. And you have to take HM 803, which we have taught in this one, which I teach. You do that in the summer before your second year of vet school, and then you don't have to take these 2 required courses of vet school. And then under block tuition, you can take some MPH courses.
So the 3 ways to double dip with the MPH is you get 9 credits of your DVM curriculum that will transfer towards the 42. Plus, if you start soon enough, you can take these 2 courses. That's another 6 credits that count toward your MPH. And then using one of your electives, clerkships, to also count as your practicum experience for your MPH. So those are the 3 ways to really maximize the benefits of the dual degree for the MPH. And then the DVM MS in food safety, this is a 30-credit program versus 42 credits. But we don't have as many double dipping opportunities. The same 2 apply, that you can transfer in 9 credits of your DVM curriculum to count toward the MS program. And you can use one of the rotations for our final project, which is an applied project, of course, called VM 815. So you have the two ways. We don't have the course swaparoo, as we call it. That's the third option that the MPH has. But it's altogether it's a little less expensive because it's fewer credits are required. So this is considered a professional master's in food safety program. And I have handouts if you want more details about the food safety. I have two handouts up here in terms of spelling out which courses, what the topics are, and so on. But most of the students that are in the food safety program are currently working for food companies right now. So most of the students are mid-career. The people that have hit a certain point in their career and they want to move up, or they're a really good employee. So again, most of them are being sponsored. I'd say half, not most. Half of them are being sponsored by their companies to go back and get their master's. So it's kind of a neat interaction, where in the courses and discussions you'll be hearing about, current food safety issues that people are dealing with it within their own companies right now. So it has a very, very applied feel to it. On the other hand, since you're not working in food company right now, sometimes the dual students feel a little bit like, well, I'm not sure really how to contribute to this discussion. But in general, the dual students have a great time, and they can find ways to apply whatever the issue is to their, what they know from their vet school experience or real life experience outside. So slightly different audiences. The MPH students tend to be younger. A lot of them are coming right out of undergrad, going into their MPH program, or they're dual students. There are a lot of dual vet students, clearly, the 38, plus there are some dual medical students.
And
a couple
osteopathic, yeah.
Osteopathic, most of them are osteopathic students. So, again, the vet students and the med students tend to be the cream of the crop for the MPH student crowd.
So I'm going to kind of skip over some of these things on the clerkships because I'll get to talk to you about these later. But if you're interested in public health and public practice, there's some clerkships that you can take in your third and fourth years, and we'll talk more about those later. You can look at the slides here. Let's go right, because I want to leave time for questions. So now I got the scary bad news, some scary graphs to show you here. So there's been some articles coming out on the economic outlook for veterinarians, and this is some graphs from the New York Times article last year, and I actually did a screen capture. I don't know how we can see that, but it shows a decreasing number of visits to veterinarians. So private practices are getting fewer visits. There's fewer pets being owned. This graph in the middle here shows the number of new graduates coming out of vet schools, because the vet schools need more money, so someone always says, well, let's just add more students, or let's start a whole new vet school. And so that's going up all the time. The average debt load is going up, and the starting salary for veterinarians is going down. So these things are contributing to a lot of veterinarians, I think, looking at alternatives to private practice. Yes, question? Yeah, that looks like it was about 50, doesn't it? Maybe that looks like, I'm thinking that was maybe about 50, and that's going down. I don't know how they compute that. I've got the original link on there. You should look that up in your spare time. This was an article out of the New England Journal of Medicine looking at the ratio of debt to income for different professions, and this is us here. And we started out bad and we got worse. And then the AVMA did a study, and they concluded an unsustainable economic future. Basically, they say an 11 to 14% underutilization, which is kind of a weird way to say that, but basically what this makes a lot more sense here. In 2012, they say there were 79,000 jobs, but 90,000 vets looking for them.
So that's where you're going to end up with more and more part-time positions being offered too. This is where those numbers are going to head.
So I think that some of these economic pressures on private practice, including, there's a lot of the private practices are going to like a franchise type thing, and so there's less private ownership of private practices, and that may really impact the profession as well, just like it did with optometrists. When I was young, optometrists were all private little optometry, offices, and
now these big mega 5 locations for Lansing ophthalmology. And
pharmacists the same way.
Yeah.
So that's...
this is the good news.
Yeah, this is the good news. So one of the reasons also for the increased interest in public practice and in starting a dual degree so you'd be more competitive for the public practice jobs is this loan repayment plan, which is amazingly good. Basically, you can pay like 10% of your salary for 10 years, and you're done with your student loan, no matter how big it was. So if you're making $50,000, let's say, and you paid 10%, that's $10,000 a year for 10 years. You paid $50,000 total. You're done, no matter whether you owed $500,000 or $300,000 or whatever you owed.
With the caveat, it has to be in local, state, or federal government.
Right.
Which is why we're here. So.
Yeah. So on campus, we have Diane Batten is the person that I found who seems to be the most knowledgeable about this. There's a lot of school teachers do this, so if you know any friends that are school teachers, you may be aware of this program through them. It's the same program. And you don't pay any taxes on the amount that you're forgiven either, so it's pretty sweet. The federal government could cut it at any time, but traditionally the government has grandfathered in people that have already started. I can't believe that you'd be a year or two along and they would suddenly decide to cut the program and say, okay, you're out. They would probably let you continue if you were already in.
And this is kind of an effort for the government to make some of these public sector jobs more attractive to top-notch candidates. So, that's you guys. So how do you recruit really top students, top professionals into jobs that are not, the salaries are not competitive with private industry in terms of top-notch talent. So this is a way to get physicians, to get veterinarians, to get other professionals into public sector work, which is it's actually really good work, but it doesn't necessarily come first into your mind when you think of what your career is going to look like.
So we have a few minutes. I wish we had a few more for any questions that you wanted to ask.
Yeah, so you were talking about the job stability of working with the government. And I was kind of curious with the CDC, are there any positions where you would be traveling to, say, areas of new outbreaks?
Oh, yeah. Yeah. Yeah, they're called medical epidemiologists, and DVMs fit in that category. Absolutely. Within CDC, there are folks that work on rabies. There are folks that work with special pathogens, with zoonotic diseases. But you're not really limited just to zoonotics. That's the beauty of it. I did a couple of years with CDC with the training program, and I spent one summer working on foot and mouth disease in England, and the next summer I was working with polio in India. Exact same skill set, right? I mean, really, your basic epi tools are exactly the same. It's just you're working with subpopulation of animals here, subpopulation of humans here. So you're not restricted in any way just to work on animal outbreaks. You can go and do your, that same skill set transfers to people. Yes, lots and lots of opportunities to work on international. And CDC Global is a website you should check out. So, yeah.